Tonight's Community Health Champion and the winner of this year's Dr. Rodney L. Huey Memorial Champion of Oklahoma Health, the Tulsa County Recycled Medication Program. For years, many of Tulsa's needy went without the medications they required because they simply could not afford them. A group of concerned citizens realized that something had to be done about this situation. And through the Tulsa County Medical Society and Tulsa County Social Services, they developed what is known as the Recycled Medication Program. This program was led by Dr. Jerry Gustafson, Dr. George Prothrow, Michael LaPala, and Miss Linda Johnston, who is the current director of Tulsa County Social Services. It is the first program in the country to legally recycle unused prescription drugs from nursing homes for use at the Tulsa County Pharmacy.
My role was to simply do a feasibility analysis of would such a thing be legal, would such a thing pass regulatory muster, could such a thing interact with people in a meaningful way. So once people were assured that this is a good idea that was feasible, then they took it from there.
For years, nursing homes have destroyed unused prescription medications that were no longer needed, but had not yet expired.
All this stuff is ordered for patients, and it's not all given. And it's not because they all died. Sometimes they're allergic to it, sometimes it's not required, whatever. Much of this medicine was still usable, still potent, and could be recycled.
Thanks to the efforts of these forward-thinking individuals, the medications are now simply rerouted to a local charity pharmacy rather than being destroyed. The primary objective behind the program was to provide prescription medications to those who could not afford them, and without any additional expense passed on by taxpayers. Although the idea seems simple enough, it did require the medical society and county officials to work legislators, as well as long-term facility owners and staff. The idea also attracted plenty of media attention, as it was such a groundbreaking idea.
I think it took 5 legislative sessions to creep up on the final device or method that works. With the House and the Senate, these really wonderful people, this bill was finally written, and it's functioned well.
During the 5 years the program has been operating, over $5.5 million in medicines have been distributed by filling over 55,000 prescriptions for those who needed various medications.
We currently have 57 nursing homes, and we have 27 retired physicians of Tulsa County Medical Society who travel to the nursing homes and pick up the medications and bring them to the pharmacy. So we're very grateful that they're willing to do that.
Right now, 37 states across the country have replicated this program to one degree or another.
Because of the volume of the medicine that we're getting, we're finding that we're expanding our eligibility more and more and more. We all know that access to affordable medication is a national issue, and this program has gone a long way to help meet that need in our county.
Throughout Tulsa, thousands of patients have benefited from the program.
This has benefited me 100%. If it wasn't for this program, I wouldn't know exactly what other than this to help me get my medication. This program means my life because this will provide the medication that I need.
The obvious beneficiary is people that can't afford their medications. But there's other beneficiaries too, not the least of which is the taxpayers of Tulsa County. So this is almost found money.
And in 2007, the Medical Society physician volunteers were honored as the nation's daily point of light by former President George H.W. Bush. Please welcome tonight's Community Health Champion and the winner of the Dr. Rodney L. Huey Memorial Champion of Oklahoma Health Award, Tulsa County Recycled Medication Program.